Well, good afternoon, everyone, and welcome to a big day for 4 cities on the eastern side of Dallas County. My name is Cliff Kahele. I'm the city manager for the city of Mesquite, and on behalf of the cities of Balch Springs, Mesquite, Seagoville, and Sunnyvale, I want to welcome you to the kickoff of the Southeast Alliance Community Care Team. This team is an important step towards providing a resource for residents in our communities and changing the way we handle mental health issues in our cities. Today, I'd like to welcome some of our elected officials who are here today. From City of Balch Springs, we have Mayor Carrie Gordon. Thank you for being here. From the City of Mesquite, we have Mayor Bruce Archer. And Councilmember Dan Alleman. Councilmember B.W. Smith, and Councilmember Kenny Green. And very important for a city manager, did I miss any other city council members? All right. And I also want to welcome County Commissioner John Wiley Price. Thank you for being here. And Dallas County Administrator Daryl Martin. In the summer of 2020, following the national events and discussion on policing and other needs in our communities, Dallas County began a local discussion called New Directions in Public Safety. Through this discussion, led by Daryl Martin, city managers and representatives from various cities in Dallas County met to discuss issues facing people in our cities. I found this discussion to be profoundly educational, and it spotlighted many needs facing people from a variety of backgrounds and experiences. What was clear from this discussion was that not one city could provide the services needed. While suburban communities look to the county and city of Dallas for programs and partnerships with nonprofits, it was clear that these problems are not just big city issues. They are in our suburban communities, and they were being experienced by people that we deal with on a daily basis. And it was during this discussion that we learned of a program in Oregon that had tremendous impact on reducing the reliance on police officers in responding to people with mental health crisis. These teams were not only able to respond to people in crisis, but they proactively worked with residents to follow up on issues and provide transportation to ensure that people in need found the care that they deserved. The result in the cities that have adopted this model is a significant drop in the number of police department responses for mental health calls. So it was following this discussion that I learned while all Mesquite police officers receive crisis training related to mental health issues, there were additional training that was available. And there are different levels of training that we can provide. And it was more clear than ever that this training was needed, not just for police, but for our firefighters and for our dispatchers, everybody involved in public safety. So following this presentation, I learned that several of my fellow city managers in this area were having similar discussions with their city councils about these issues. And not knowing the need for a true need for a response team, we realized that the budget impacts of each city formulating a response program on our own would be very difficult with our limited revenues. So when Dallas County announced their grant program for the New Directions in Public Safety, our 4 cities determined that a combined effort would give us the opportunity to evaluate a program and truly make an impact on our citizens. We cannot thank Dallas County enough for their support for our cities and the funding to give us the start that we will know will bring much needed help to our communities. And as you will hear, each city has a need for this team. Each city needs an officer, firefighter, and dispatcher trained to work with people in crisis. We need to address the growing number of homeless individuals and near homeless individuals in our community. And I appreciate all of the city council members in all 4 cities who saw the need for this service and joined us as we applied for this grant and began the effort to form this team. Your support of this program and the commitment to its long-term success are examples of your leadership for your citizens, and we really appreciate it. And today, while we celebrate the start of this program, you will hear that it is just the start. There is much more need in our communities when it comes to response services and training. We hope with our experience in Mesquite, Balch Springs, Seagoville, and Sunnyvale, that funding for resources that can be identified for more programs to address more needs that come about. So at this time, I'd like for you to hear from some of the other cities involved in the partnership. And so I'd like to bring up Susie Cluse, the city manager for the city of Balch Springs.
Thank you all, and I want to introduce also, we just had a council member that walked in, Miss Marie Today. She's in District 7. Welcome, Miss Today. But I want to welcome you all here within the city of Balch Springs, and I am so grateful for this collaboration and this partnership. And when I call him my big brother Cliff, when he asked me if I wanted to be a part of it, you know, I just knew this was something we had to be a part of. So especially with the city of Balch Springs, this is not, and I am in no way politically correct, so don't take anything I say that out of text, but this is not a Democrat or Republican problem. It's a humanitarian problem. And this is something that we have to deal with, and it has no boundaries, no age, race, color. It happens to everyone. And it's apparent now because now you're seeing it happen in schools. No one knows why, and everybody's looking for the reason why it happened, what sparked it, what's going to happen. But this is something that we can no longer put a Band-Aid on. This is something is gushing, and we have to adhere to this. We have to take notice of this, not only outside within our city limits, but outside of our city limits in our region. Because right now what we're doing, we may, if we see something in Balch Springs, they may go to Mesquite for a minute, they may go to Sunnyvale for a minute, or Seagoville, but they're right back and they're circling around. So there's a need for this. And when Judge Jenkins started talking about new directions, and we started looking at our budget and we're going, okay, how do we make this work with the budget that we already have? So when the grant came about and Cliff asked us if he wanted to be a part of it, I mean, I leapt at the chance. So this is something that's good, not only for the city of Balch Springs, but for the entire region. And I'm so thankful to Dallas County, and I'm glad you were able to be here, Commissioner. But this is something not only within our city, but also for our first responders. It's not a police issue now. We're seeing it spill over into our firefighters. They have to deal with it as well. So, and not only that, let's just say what it is. Also for our police officers, what they have to deal with on a daily basis. How do they recognize it? How do we train them? We don't know ourselves what we're looking for on a day-to-day basis, and how do you even determine if it's mental health? And this is a great start. And I'm so happy to be a part of this, and that Balch Springs is a part of it, and that I'm working with a great group of people, but also to have the support of our citizens and of our council members. This is awesome. And of Dallas County giving us the money, we appreciate you very much. But also everyone else involved, Ms. Marshall. I mean, even our state reps. I know Tony Rose wanted to be here today, and she may have shown up here, but that's her platform, mental health. And I ran across something, there was a Southeast medical study done in 2015. And I mean, the pamphlet was about this big, but when I started looking for behavioral health, it was in the rear, in the back, only a couple of pages. Nothing about it was addressed. They gave you the definition of it, but how do you recognize it? How does our police officers and our first responders recognize? I mean, even with dispatch, how do you recognize it, and how do you prepare yourself for what you're going to face? So this is a great jumping off point for us. I appreciate the partnership, and I look forward to where we're going to go with this. So thank you all for being here, and thank you for your support. I appreciate you. Thank you.
Good afternoon. I'm Susan Guthrie. I'm the town manager for the town of Sunnyvale. And on behalf of Mayor George, I just want to thank you all for being here today. This is a really exciting event for us to kick off this program, and it's really heartwarming for me to see so many of you here to celebrate it with us. I want to do a shout out to my police chief, my fire chief, and my leadership team who all showed up today to share in this with us. You know, they say it takes a village, and that can be applied to so many things, but in the last 3 years as the town manager of Sunnyvale, I have felt that more than any time in my entire career. And I remember I think my first month on the job, I met with Commissioner Price, and for decades, the Sheriff's Department had provided police services for Sunnyvale. And Commissioner Price and I met, and he said, you know, you really need your own police department. It's time. So over the next year, we stood up our police department, and that was in the midst of so much that was happening in our world. And that was what, you know, really came across to me is we have this super unique opportunity to do this right and to do it in an amazingly quality fashion. And so around that time is when the people on either side of me, Seagoville, Balch Springs, and Mesquite came and said, hey, we'd like to work together with you on this grant. And I was all in as the little sister in the group. But, you know, for us standing up our police department, we got a lot of mentoring and a collaboration for radios with the city of Mesquite. Susie gave me so much mentoring over the last 3 years, and Seagoville, actually, we're in contract with them. They do our jail and our dispatch. So you see that this taking a village concept doesn't just apply to this subject. It's all of us treating this as a region and owning each other's issues. And I'm telling you, this is not a socioeconomic or a political or any other kind of issue. It affects each and every one of our communities in a really big way. So I'm so thankful to be part of this group and to be working with these amazing leaders. And we're very, very thankful to Dallas County for having the leadership to get this started, but also providing the funding. So thank you all. Appreciate you being here.
Thank you, Susie and Susan. Again, we found that we work well as partners, and it's a good team. And hopefully, we'll be announcing some additional partnerships down the road. But as we were in the budget sessions in 2020, the Mesquite City Council was actively discussing mental health needs in our community. And at that time, they directed funding, not knowing that this grant was here or was going to come about to do something for mental health. And we're going to spend some time trying to figure out what that was for Mesquite and what worked. And we were fortunate to find Melissa Carr. She is our mental health program coordinator, and she is responsible for the community care team and will supervise it as it moves out into the community. But she will also be supervising the training for all of our public safety officers. And she will also be helping our homeless coordination and services as well. So I would like for Melissa to share with you a little bit more about how the team's going to work and how it will interact with the community. So Melissa, thank you.
Hi, good afternoon, everyone. Can you hear me? Okay. All right. Thank you, Cliff. I appreciate that. And I'm super excited to talk about this team and what it's going to be able to do for all 4 of these communities. The Southeast Alliance Community Care Team, it is going to be comprised of not only myself as the program manager, but it will have a social worker and a paramedic on the team to answer any calls that the police or fire may need help with. So, you know, kind of going back a little bit, I think everybody's heard these stats that I'll rattle off. Depending on which research study you're citing, 1 in 5 adults have issues with mental health conditions. 1 in 6 youth have experienced some type of mental health condition. And mental health are at least 20% of public safety's daily call load on each shift, 20%. That's a large number. And like I said, we rattle off these statistics and we kind of know them. I know them like the back of my hand. But now, for the first time in a very long time, as a social worker, I feel like we're going to be able to do something to bring that number down, to change those numbers. And like they've set up here on the panel, the city managers, it does take a village. It's going to take everybody together to do all these things. And so it's exciting. I feel like it's on the cusp of something great that can change numbers that we have been citing for 10, 15 plus years. There's some mental health professionals in the audience I know that could tell me how long they've been saying these same numbers over and over again. With that being said, we're going to have a team that's comprised of a social worker and paramedic. They will be Parkland employees. We have some contracted with Parkland to provide them. They will come to the office at Mesquite every day, and they will start taking active 911 calls. So how we will do that is, it's kind of planned into 3 stages is how we're doing this. Is phase 1, as the team comes together, they've literally just been hired, I think about 2 days. I've been here about 6 weeks, getting policies and procedures up and going and getting all the things, ordering things and things like that, and working with staff and creating relationships. The social worker and the paramedic are about 2 days into their employment. So we're getting ready, we're getting things up and going. Now Mesquite, Sunnyvale, Seagoville, and Balch Springs will have the capacity and the capability to contact the community care team and have them dispatched to their location or make a referral. So it might not be an active 911 call, it might be a referral that they'd like for us to check on someone later, or we have to follow up with somebody that they've been dealing with in the community. The team will help de-escalate a crisis by using trauma-informed care and harm reduction techniques. The team will assist public safety in a supportive role to enhance the ability to identify the factors in the call and to help provide on-scene decision-making for the citizen in need. The community care team will also provide transportation to outpatient mental health clinics if needed. We've been very, very fortunate to be able to partner with several outpatient mental health clinics that are willing to take our clients same day to lower the need in the hospital burden that the ERs are seeing with clients that are suffering from mental health. So we're very lucky to be able to partner with them and grow our partnerships and show that the need is there. This region, the Southeast Alliance covers, Mesquite, Balch Springs, Seagoville, and Sunnyvale, does not have a lot of mental health patient clinics. So we're going to, hopefully with this grant, we'll not only be able to show the need for training for police and fire, but we're going to be able to show the need to have clinics come out down to the Southeast sector to show them that the volume is here and we need people all hands on deck. Okay. And as I had mentioned, the team will go out in phases. Phase 1 will be the reactive response to 911 mental health crisis calls when they are dispatched by public safety. Public safety will also have the ability to refer citizens directly to the community care team for proactive scheduled follow-up appointments to address issues with transportation, to mental health appointments and medical appointments. They will be able to obtain appointments for therapy and psychiatric care and address any other social needs. As I've been here the last 6 weeks, we've had calls, people hear there's a social worker in the house and see what we can do to help. And so I've had calls to help different people do different things. And it's not the exact what you would think a mental health call would be, but the need is there. There's a need for, there's a social concern, whether that be for food, whether that be for, housing, utilities, anything that could come across as need, especially right now, given COVID and, some things turned upside down as they normally wouldn't be. A person just can't walk up to some of these food pantries that they once would or medical clinics that they once would. So they need help navigating that system. So we are able to do that. The team will be using recently established relationships throughout DFW with the mental health clinics that will be growing every day, because once we see what the call load looks like and what the need is, we'll have to reach out and probably to everybody here and see what you have available and what we can use. So phase 1 is the proactive and reactive response to mental health. Phase 2 is the care team, along with police and fire, will actively seek out persons experiencing homelessness to build trust and assess them for social, medical, and psychiatric needs that they might have. These calls traditionally have been handled by public safety. You call 911 if you see someone who is homeless, you call fire, things like that. We will actively be seeking them out, kind of, for lack of a better word, mapping where they are to try and go build relationships, to try to tell them, hey, we're here, what do you need and what can we help you with? And again, that will create partnerships. We've reached out, we've talked to different agencies, and we're going to create partnerships to help house any individuals that desire housing and work with citizens for any services that they may need. Okay. Phase 3 of the New Directions Grant and the Community Care Team will be develop improved training for public safety agencies within the Southeast Alliance and any other public safety agency in Texas that wish to attend. These trainings will be regarding persons with mental health conditions, persons with disabilities, persons with intellectual or cognitive disabilities, and persons with emotional or behavioral issues. These trainings will have real scenarios that with the work that the community care team has taken on and with public safety. And people will ask, why is that phase 3? Because really, should that be phase 1? The team needs to go and see what police and fire are seeing, so then we can help them and address the issues. Instead of pretending to know what's going on in the community, even if you live in this community, you might not know every day what a police officer, what a fireman, what a paramedic does every day. So we need to be able to see it and see how we are helping, and then see what could be trained and what could go work better, what else do they need? And hearing from the officers themselves. The city, Mesquite did do a needs assessment with police and fire, talking about what the needs are. And most of the responses regarded training and services. The lack of services, where do you take somebody? Where do you bring them? Do they even need to go anywhere? Can someone come to them? And the officers, some officers do know, some officers, or they know about one agency, but they don't know about the other. It just kind of depends on how they were trained. And so this team will help point them in the right direction and help them and grow the partnerships. The community care team will track all relevant data to show mental health and social service providers the need to expand into the southeast area of Dallas County. The team will hopefully decrease the amount of time public safety spends on 911 mental health and homelessness calls with those relationships that we've developed. The team will also build new relationships with any mental health and social service providers to help the citizens of the Southeast Alliance. The community care team will collaborate with public safety, ultimately to create a difference in these communities, making them healthier, safer, and more financially secure, because people in the area are able to get the services that they need, and we're taking the pressure and the money out of people that are responding to the calls. Okay. So we'll also keep continuing to do needs assessments and see what's needed from the community, and we'll be pivoting to cover whatever we can whenever it's needed. Okay. All right. Thank you all very much.
Thank you, Melissa. And every once in a while, the city manager feels really good about somebody being hired in their organization who hits it right on the head. So thank you, Melissa. And first of all, I'd like to thank my fellow city managers for their partnership. And again, big supporters, hard workers, and really big advocates for their community. So thank you for all that you do. Before I get too far along, I do want to recognize State Representative Retta Bowers for being here. She has also been a big supporter of our community efforts, and we really appreciate our partnership with you. So I would like to thank all of our elected officials in the 4 cities for your support, and most importantly, the ongoing funding that'll be coming down the road once the grant funds run out. We expect this program to grow. We're starting small, but we expect to expand very quickly. And over the next 5 years, you'll see multiple teams out there responding across the area. I'd also like to once again express my appreciation to Dallas County for their support with the grant funding. I know there's a lot of challenges and a lot of needs in the county, and setting aside these funds means a lot to our 4 cities, so thank you. I'd particularly like to thank Daryl Martin for coordinating the grants and for the support of this program. He was very instrumental in our application for the grants, but he also took on a heavy burden during a difficult time with COVID and everything else to organize and direct the new directions in public safety. It was a tremendous effort. He brought in a lot of good people, a lot of good discussions, and like I said, it made a tremendous impact. So Daryl, thank you. And I'd also like to thank Mark Kirby, our Special Projects Director and former Fire Chief for the City of Mesquite. He was handed a conceptual idea from a group of city managers and was able to bring it to fruition. He brought about many of the innovative changes and ideas for the partnerships that we had not originally contemplated, and found a lot of problems along the way and brought great solutions. And I give him 90% of the credit for Melissa Carr. So thank you, Mark. At this time, we're going to do a quick photo shoot with all of the elected officials and the city managers. And then all of us will be around to answer any questions for anybody who has anything. Thank you for your time today.